Hello guys, so today's video I'm going to help clinicians who are trying to pivot into other areas with their skills and knowledge that they have. So the first thing that you want to do is you want to list all the different skills that you have. Evaluation skills, which we are so great at, assessment skills, advocating skills. Another skill that we have is also transition skills. We are able to help patients transition from one setting to the other, from one level of care to the other. So that's a very, very important skill to have. Education skills. We are also problem solvers. So another skill is also writing skills. Like we have a lot of writing skills because we do a lot of documentation, documenting your evaluations, documenting your discharges, your research, your daily notes. All of those different things actually help you develop writing skills. So you can even think about maybe doing something like a blog, and we'll talk about that later on in the video. Creativity skills. So all of those different skills that we have as occupational therapists, as physical therapists, speech therapists, cotas, PTAs, go ahead and sit down and list all of those different skills out. For me, I think when I did that, it really gave me a lot of perspective about all the different things that I have acquired over the years and how I can really transfer those skills into other areas. Okay. Second step that you're going to do is very similar to the first step. The second step is you're going to list the different knowledge that you have. So what kind of knowledge do you have specifically? And this is going to look very different for each clinician. For me, I have a lot of knowledge about a lot of different diagnoses and symptoms and things like that. However, we all have a lot of knowledge about different diagnoses and different symptoms and how to treat those different diagnoses and also symptoms. So this is very knowledge based. Just make a list. I have knowledge on stroke rehab. I am adult physical disability occupational therapist. I specialize in adult physical disabilities. And so I have a lot of experience working with people in rehab who are trying to go back home. I have worked with patients who have stroke, who have cancer, who have Parkinson's, dementia, obesity, hip fractures, knee fractures. So I have all of these extensive experience and knowledge in physical rehabilitation. So that's my knowledge base, right? So sitting down and thinking about those different knowledge that you have in those different areas will really also give you even more perspective about the skills that you have, about the knowledge that you have, and how you can transfer those skills and knowledges into other areas. Okay. So some of the knowledge-based skills can be the different interventions that you have acquired, you have learned through just working with your patients or your clients. You may have really great feeding skills. You may have really great play skills when it comes to working with kids. You may have really great skills with working with patients with dementia. You may have really great skills with maybe self-care interventions or transfer interventions, education on maybe getting wheelchairs, adaptive equipment. So those different knowledge that you have is going to be worth a lot when it comes to learning how to pivot those different skills and knowledge that you have into other areas. Okay. Now, the third thing that you have to do after you have listed your skills and have listed the different knowledge base that you have from just working with different clients and patients, the third thing that you want to do is to connect the skills and knowledge that you have to other areas, to other jobs, to businesses, to side hustles, okay? So for me, for example, I have transformed a lot of the skills and knowledge that I have acquired from not just being an occupational therapist, but just from working in healthcare for many years before becoming an OT, and also from all the different jobs that I've had in my past. I have been able to transfer those different skills into where I am now and what I'm doing now, which I do have my own business. I have a consultation business. I do take clients one-on-one on Zoom. I have created ebooks. I have done workshops. I have done classes and still continue to do classes. I have done in-person retreats. So all of those different things that I have done is because of the knowledge and the skills that I have acquired over the years. Okay. You can also do the same thing. Whether being that you want to do a workshop, or maybe you want to do courses, maybe you want to do some guides, some classes, maybe you want to write an ebook, maybe you want to sell things to clinicians or patients. Maybe you want to do private practice, right? And I always want to mention that part because I know that not everyone wants to do private practice. There are some people that do not want to do clinical work, and that's okay. You don't have to do clinical based work. You can also have a non-clinical business as well, right? So we'll talk more in depth in other videos about that and what that looks like, but you can honestly transfer those skills and knowledge into many different areas depending on which ones you are very interested in, which ones are you passionate about, and which ones can you see yourself in the next 5-10 years doing. Okay. Another thing that you can do with, especially with the peds, OTs, PTs, SLPs that I have met, is you can do like a feed-in camp over the summer. You can do like a handwriting camp over the summer. There's a lot of different camps or like classes, workshop that you can do for patients, for caregivers, and also for your clients or patients, okay? For my adult OTs, PT, SLPs, you can also have like maybe like a Parkinson's class where you can teach people with new diagnosis, or maybe you can do like a dance class, maybe you can do an exercise class, you can do maybe a fall prevention class, you can do, I don't know, a self-care class. You can do so many different classes in the community. So you can still, if you are an adult OT, PT, SLP, you can still have different areas where you can also have classes. Okay. And the fourth thing that you want to do is you want to learn how to run a business. And this is something that a lot of us do not know how to do because we are great as OTs, PTs, SLPs, right? But when it comes to the aspect of business, we really don't know how to do that. And that's okay. If you have never actually been a business owner before, if you have never had the experience running a business, then you're not going to know exactly what to do. So I always tell my clients to take some time to really educate themselves about what it is to have a business, to run a business, to scale a business, to have a very successful business. Okay. You have to learn how to set up a business. You have to learn how to market a business. You have to learn how to protect your business. You have to learn how to scale your business. You have to learn how to hire and fire, okay? And you have to learn how to collaborate with other clinicians in your expertise or in your field or in the niche area that you're trying to start a business in. This is very, very important. Your network and who you know is honestly true. It is your net worth. Who you know is your net worth. So you have to be very keen about doing a lot of networking in your area with other clinicians. Maybe if your business is online, doing a lot of networking online as well, a lot of collaborations and partnership with other clinicians. This is really going to set you up to be successful because you are going to need those people. And another thing that I always remind myself and other people is that I have my strengths and weaknesses. You have your strengths and your weaknesses. And when we come together, maybe what I'm weak at and what I'm not that great at, you may be strong at that. And then us coming together, we can kind of learn from each other and help each other grow. So partnership and collaborations is top notch. You have to learn how to do that to have a successful business. Now, the fifth and final thing that you have to learn how to do is you have to work on your mindset. Okay, this mind right here, if you don't have your mind where it needs to be, you are going to struggle when you start to run a business or even when you start to think about pivoting into other areas. Your mindset has to be positive. You have to be able to think of yourself and the things that you want to do in the positive light. You have to have some type of faith in being able to take the step that you need to get to the things that you want to do. If you don't have faith, if you don't trust yourself, if you don't think that you're going to make it, then it's not going to happen for you. So do a lot of work on your mindset, on the way that you think, work on your confidence level, work on who you are. You don't have to change who you are, but there's certain things that you will have to change and make adjustment to if you want to have a successful business, if you want to start a successful class, workshops, whether being online, offline, you have to work on your mindset. And I hope this was helpful. I'll see you guys in the next one. Bye, guys.